Clinicians that take on a supervisee have dual roles in who they must be accountable to. They must simultaneously uphold their duties as a service provider and one as a clinical educator. This module will assist supervisors in better understanding how to balance the welfare of both the client and the learning process of the students they take on, so that all participants feel safe, fulfilled, and appropriately coached. Furthermore, this module will make clear the different agencies, documents, laws, and guidelines that a speech-language pathologist is accountable to, both as a practicing clinician and those specific to the role of supervisor. This systemic breakdown of accountability is meant to illustrate the network of legal bodies that those within the profession are legally bound to, and will help to make apparent what may be common information to the supervisor and the subject of a lot of confusion to the supervisee. Story's study found that supervisory experiences were impacted significantly when students with emotional disabilities were not properly supported. Due to the invisible nature of these types of disabilities, along with the social stigma and bias connected to them, non-disclosure is very high within this group of individuals. Supervisors in the study overwhelmingly reported feeling like there was a lack of support from their colleagues, administration, and those at the university. Supervisors, many times unknowing of the disability, interpret the student's behavior as non-compliant and label them with characteristics such as having a behavior or attitude problem, being negative, unmotivated, or overconfident. Just as we are with our clients, supervisors should be careful about when they assign these characteristics to an individual they are working with. It is more beneficial to reflect on the root causes and triggers for the behaviors they are interpreting as negative and entering into communication while building rapport to mediate them. Perhaps the most important takeaway from this module is that while we are here attempting to provide support, education, and resources for supervising students with disabilities, there is no one correct way to do so. Just like with any other student, the clinical experience will need to be tailored to the specific student case at hand. Dr. Jane Jarrow wrote a piece entitled Students with Disabilities in Classroom and Clinic, Business as Usual, in 2012 that offers a good introduction to the module through a series of do's and don'ts. These do's and don'ts help supervisors to check their reactions to disabilities and maintain their high expectations for every student that they are matched with.